My name is Nathan Faw. I'm a licensed clinical addiction counselor. This is Bridget Sherwood. She is a licensed addiction counselor. Today, I believe we were going to talk about just kind of looking back at maybe the history of kind of like psychiatric and mental health treatments as they kind of occurred throughout the past, and really how there's some really kind of terrible things that I guess people have done over the course of history to either I don't even want to say to try and treat people. I mean it's almost like medieval torture is more what it seems like. But I guess I'll kind of ask you. I mean, I think you maybe went a little bit farther back into some of the history than I did. I looked at things maybe more coming from maybe like we'll say 1900 on, but yeah, I'll just kind of maybe turn it over to you. What Well, I suppose before we get into that, did you have anything that you wanted to say before we get into this?
Well, just being really excited to talk about how things have come a very long way, and just the history of fixing the crazy and hiding the crazy, as people coin them to be. And really, what I guess started this for me was the American Horror Story show. One of the seasons, I think it's even the third season, is called Asylum. And a lot of the stuff that they do in there, they've pulled from these techniques, if you want to call them that. But even looking through these, just going all the way back to kind of like what I was saying earlier about Hippocrates and the four humors, and just everything that trickled down after that.
Yeah, so I guess we could kind of we could kind of start there. I mean, you know, what were the things I guess that I guess where do you want to start? I mean, where does this journey start for you? I know you said, kind of the idea came from from like the American Horror show and, some of that stuff, but I mean, where do you want to?
Well, I think that we start with where things started as far as this whole idea of understanding mental health. And that starts with this technique that they called trepanation. Because when I was looking into all of this stuff, it wasn't about depression or anxiety or schizophrenia. It was about this demonic possession of the mind. And that's where trepanation comes in. And they would use a boar or an auger to create a hole in the skull in order to release the demons. Some
Is
of
that what
this,
that word means? That's a word I'm not really that familiar with. I mean, do you have
the trepanation.
like a definite? I mean, is that what it means, or I mean, is it?
So that was from what I saw, and I don't know if I'll say just the word itself right, but there was a tool called the trepan, and I think that's where they just went with the trepanation.
So
And
that was like the process of using that tool.
hmm yeah, and the size of the holes I think varied by whatever it was that they were using.
Size of the demon in you.
Yeah, pretty much. um, but that's what they were doing was basically, I guess, opening a door in the skull to let the demons escape. And I think, people were able to survive for a short period after time, but I mean, they were just doing this raw. I mean, there was no medicine, there was no like way to put them to sleep or anything like this. And more oftentimes than not, I think a lot of people died, as you would expect if somebody's going to be drilling a hole in your skull and removing that piece. And that's what they did. They didn't seal it back up. They just left that piece of the skull out. And there was even, just the human remains found with these skulls that were missing things. And I think that's how they were able to go back so far to see when this started.
Hmm.
Um, and so there was just a little bit about this trepanation, and that kind of led me into bloodletting. And there were some other things, but it really just surrounded this idea that we were possessed, and that is why we were being so crazy. Um, and bloodletting wasn't just specific to mental health; it was also like in the medical field, and it was used to cure any and every type of ailment. It was either performed by a physician or by leeches.
Hmm.
And something I had found was there was, and I didn't look too much into it, but where it had entered barber shops, and so there are little red and white poles outside of their shop represented that they would do this bloodletting, the color red, obviously blood. I don't remember what the white was. But that it turned into what we know today, distinguishing doctors from surgeons, and the barbers were considered surgeons for whatever reason. Um, but that's kind of where my research started, and I have more, but I guess I'm curious if you found anything as far as just demons go.
Well, I guess my short answer is no. I mean, I started maybe in a little bit different place than you did, and that's why I'm a little curious because, like I said, with kind of what you found, because I think that maybe provides a little bit more of a historical context leading up to kind of where I picked this up. I mean, I guess where it started for me when I started looking into this was, you know, just kind of maybe looking at the short history of, I suppose, even in some ways what you could say like, current mental health, practices. That's maybe the wrong way of saying it. But anyways, started, just looking at, kind of with asylums and, at least maybe what we think of as an asylum, really starting in like the mid 1700s, somewhere in there, and kind of how it kind of went from there, where initially it really was about segregation and just essentially kind of removing the unwanted population of people kind of from the world and putting them in a place where they could just kind of lock them up and essentially kind of forget about them, control them or whatever, so that they didn't affect the rest of the world. And then kind of from there leading into probably more into the like early 1900s and just looking at some of the really just, I mean, insane beliefs that they had and treatments that they came up with. I mean, we'll get into that more later, but I mean, that's kind of where my journey kind of led me. And then also looking at just like within our own state of North Dakota, and again, just the crazy, insane beliefs that we carried. I mean, specifically relating to things like eugenics, I mean, sterilization of populations of people. I mean, it's just, and essentially a lot of this was even occurring up until like the early 1980s, which is even more crazy because, to me, that seems like it's, I mean, I guess, well, I was born in 1978, so I mean, I guess that is like, 40 some years ago, but still, I mean,
Still
I
not
think
long
of the
ago at
80s,
all.
yeah, as being like, a fairly modern era in some ways. But before we get into all that, though, like I said, we can kind of, again, maybe go back to some of the stuff that you found, because, yeah, like I said, I think you had a little bit more of a historical context for some of this than I maybe do.
Yeah, and it's just a lot of, the progression and the improvements in mental health, therapy and treatment, but, just the connection between the early things that they did, like that trepanation, the bloodletting, the idea about possession and religion and, hiding it, and even exorcisms, wasn't just, I mean, obviously it was by the church, but that was a solution for a long time there. Uh,
Well, one thing we didn't even really talk about when you bring that up, I mean, kind of the religious kind of aspects of maybe some of this. I mean, even things like, I mean, like Salem witch trials and some of those things. I mean, where, I mean, yeah, our history is pretty crazy.
mhm. Well, and like, I can't remember the names, but just a lot of these people that got the titles, like, the father of medicine, and kind of like going back to Hippocrates and this idea that you can expel your illnesses, whether it's by bleeding or throwing up. Um, and that's kind of going into, I guess, where this whole thing started was lobotomies. Um, and looking at that being used so widely in insane asylums, um, because it was the same thing as that trepanation. I mean, there wasn't any sedation, there wasn't any numbing. It was just basically putting an ice pick in your eyeball and just chipping away this part of the brain that they thought were creating issues. Um, and what they found was that it wasn't working, or that it was working in their terms, meaning that you now have a person that just can't function or that they're quiet. And so they're successful in hiding the crazy, basically.
Hmm. Well, you talk about like like a lot of this maybe having, starting with like, like demonic possession and all of these other things is kind of being the root of some of the, the mental illness. But it's funny because, like you get into, like I said, kind of the early 1900s, and they kind of carried on the same beliefs. I mean, they basically like went from like demonic possession to saying that, like a lot of mental illness had to do with, like things coming from inflammation to, just, like biology being out of whack. And I mean, but they continued the same things. I mean, there was bloodletting, there was, they used vomiting. I mean, they would use, induce seizures, fevers. I mean, just all of this stuff that they thought would essentially fix it. Like I said, it's crazy. I mean, it just to think that, oh, there's something, an infection in my tooth, so that is what is causing me to be schizophrenic. I mean, it's kind of unbelievable.
It just makes me laugh thinking about how they started these insane asylums, where it was for the insane in society, but you look at it and the people who were working there, the people carrying out these um, practices and cures were more insane than the people that they coined
Hmm.
feeble-minded. And I know that's something that you'll get into later on. Um,
Well, what was it I told you that? Yeah, look at my notes here. The guy's name, Julius Wagner Juarez. I don't know if I'm saying that right, but anyways, he won a Nobel Prize in 1927 in physiology and medicine for injecting patients with malaria or malaria infected blood with the idea that if he created you know induced a fever,
mhm.
that the fever would essentially cancel out the mental illness. I mean, a Nobel Prize. It's insane.
Did you say what year that was?
1927.
Was that around the same time that they were doing the insulin therapy?
Yes. Yeah, it kind of looked like the history kind of went from, like I said, looking at, well, initially with asylums and just segregation. Then they moved into, I guess, what you would call like hydrotherapy, which had to do with basically like, I suppose, on a more like humane level, which would just be essentially throwing people in baths, to essentially hosing them down with cold water, to essentially like wrapping them up in clothes and like essentially, drowning them, to I guess release the demons. To then, yeah, it gets into, well, the first thing then, like I said, was the whole body fluids being out of balance. That progressed then into, yeah, like the shock therapies, which was insulin. God, what was the other one? I have to look. Insulin,
I only felt
metrazole, and then, yeah, electroconvulsive shock therapy, lobotomies, and
well the metrazole or however you say it. That, from what I remember reading, that went on for a while before the FDA intervened and did away with it. I think what I was saying about the use of that was for, or on this idea that people were so relaxed after having seizures that if we try this with people who are schizophrenic, then maybe they will just completely calm down and not experience any symptoms of schizophrenia anymore.
yeah, that fits like the short kind of article that I read. The idea basically was that epilepsy and schizophrenia couldn't occur at the same time. So if you induced a seizure, yeah, you were essentially going to eradicate the schizophrenia, and then, yeah, the person would be cured and would be normal.
And I don't remember if it was Metrazole or if it was insulin, but I read somewhere that they were doing these treatments or administering it up to 40 times a day
Hmm.
for extended periods of time.
That's interesting because then they actually get into like the electroconvulsive, like the, actually electrical shock stuff. And it's interesting because, I mean, I didn't get a chance to, look into that anymore, but there was actually some indication that at least had some short-term benefit, especially like with people with depression. But the problem was is that it also had some pretty horrible side effects. I mean, like one of them being like it caused people to become suicidal, for example. I mean, so
Well, and I looked into that, and there is still electric shock therapy used today. It's just used differently to treat, I think, like chronic or major depression. But where looking into shock therapy took me was the use of conversion therapy. Um, and what they found, what the scientific research proved was that it did not work. What was effective and the very few that seen some benefit from this was the use of fear, that you were going to be a disgrace to the family if you didn't change your sexual preference, and that it led to suicide, it led to failed relationships,
mhm.
and I really think that they thought it was working. And again, going into the ethics and therapy, I mean, even though these people were continuing to go back voluntarily for this shock therapy, they were just being told that it's going to work. You just have to give it time. Because what they were doing was they would put these people in a room um, that was a dark room, and they would show them images of
Mhm.
men and women in various stages of undressing. And for men viewing men, when they saw a man undressing, they would shock them. And the idea was when they would start to become aroused by a man, they would remember the uncomfortable feeling with it and then become aroused by seeing
Mhm.
a woman. And it just didn't work.
Well, that's kind of, I mean, obviously much more horrible and cruel, but I mean, that's almost like what they do, like with exposure therapy, like, which is in another one that's insane, but it's like, in a controlled setting or whatever, like an alcoholic, they would essentially, just keep feeding him alcohol until he, got sick and threw up. And, the idea being is that if they did that enough, that he would associate, getting drunk with being, with getting sick, and that would make him stop. I
Hmm.
mean, it's,
Well, and that worked so well. I mean, I think of even growing up, getting caught smoking a cigarette, and, grandpa's going to make you smoke the whole pack, and I'm going to sit here until you're done. Well, grandpa, I ended up smoking cigarettes anyway, so good
mm,
try. Is, just the same idea with this shock
you
therapy.
know. Well, yeah, I even go back. I mean, that was, thank God. I mean, before I guess my time as an addiction counselor, but I mean, not a long time before me becoming an addiction counselor. I mean, that a big a big piece to addiction treatment. I mean, it was almost like that boot camp therapy. It's like if I could shame you and break you down and make you feel like the lowliest, scummiest piece of shit, and then kind of build you back up from there. I mean, that's that was kind of an accepted way to kind of go about kind of doing treatment. And it's like, again, I mean, it's not a very good way to go about trying to help people to change or motivating people for change or whatever, is to just, kind of further reinforce the fact that there's something, like fundamentally wrong with them. I mean, it's kind of almost giving into kind of that, at least with addiction, kind of moral side to it, where it's like, yeah, there's something more fundamentally flawed with you. So let's break you down and make you feel terrible about yourself, and then we'll build you back up, and then talk about all of the good things. It doesn't make any sense,
Right. It's just we're going to shame you into being a better person.
and that's gonna make you not want to get drunk or high anymore. But yeah, like I said, and then the whole history of like conversion therapies, and it's terrible.
I wanted to go back to the lobotomy, and kind
Mm,
of the how it just became out of control. the guy, his name was like Walter Freeman or something of that nature. But Walter had what they called the lobotomobile, and that wasn't really a name that they used at the time. I think it just developed. But he went all over the country performing lobotomies, and I think he had done these on about 4,000 people. And looking at where that came from, what I found was that it was from monkeys, and they had this monkey in the zoo who was throwing his feces at people, and they had removed part of the frontal lobe, and they thought that this would work for humans too. But what got me was the part where it's an animal that can't speak. So really, how can you gauge its success if there's only one behavior that is no longer occurring?
Yeah. But I suppose that's how they did view success, even though I agree that that's really fundamentally flawed. But yeah, it's like, well, cause and effect. It's like he was engaging in unwanted behavior. We completed this procedure. Now he's not doing it anymore. So let's generalize that to a whole bunch of other stuff. I mean, it wasn't so much a lobotomy, but it kind of made me think about too. Like, I think that's when they first also kind of started looking at like or starting to understand like the kind of brain effects on, I suppose you could say, behavior or whatever. But what was that guy's name? If I'm getting this wrong, you might want to fact check this, whether it be you or the people that are maybe watching this. But I think the guy's name was Phineas Gage. He was like a foreman who worked on like building railroads, and like there was part of what they were doing is apparently they were like having to blow through rock or whatever, and dynamite went off and it like drove a railroad spike that went through kind of the almost right above his eyeball, out the back of his brain or whatever. It didn't kill him, but it severely damaged, I think, the left side of his brain or whatever. And he went from being like this normal guy that was just like had a family, had kids, very, I mean, just normal. I mean, no, substance abuse stuff, whatever. And then after that accident or whatever, I mean, he got wildly impulsive. I mean, he couldn't, he lost his job. I mean, his wife and kids left him. I mean, he ended up like dying in the gutter. I mean, he got like, just like very aggressive and just, all these kind of just very weird behaviors and stuff like that. And was kind of when they first kind of really started to pay attention that, well, wait a second, if, parts of your brain essentially get damaged, or if you, manipulate them, I suppose you could say, in some way or whatever, it can have these various effects on our functioning. But yeah, it's kind of an interesting story. And the other part, I mean, I don't think medical profession would probably get really. I mean, it's not a lobotomy, but I mean, there's still an aspect of this that is used today, like with people that are severely, like, I suppose you could say, what, like epileptic or have severe seizure disorders or whatever. I mean, where they will essentially like sever the connection between the left and the right side of the brain, to essentially eliminate the seizure disorder. I mean, they obviously now only do that in very rare, or when there's no other options available, because they're aware of how, significantly bad that is because of, what it does to the person's kind of overall functioning.
So during that time, I mean, I guess their idea of successful, especially with this lobotomy, was if you are a distraction, or if you are, problematic in their terms, whatever that meant, which was everything. And we perform a lobotomy and you're just, quiet and not causing a scene, then we've cured you.
Mm-hmm.
Which is the next thing that I really want to talk about, was this introduction of hysteria and going into the insane asylums, because hysteria was everything, and a lot of it was women. And coming back into one of the things I read was one of the solutions for hysteria was to just get pregnant. Hysteria was stemming from this. It was this wandering of the womb, and because you weren't, you didn't have a family, or you weren't carrying a child, that your body needed to reproduce in order for you to be okay.
Yeah. I keep going back to it, just using that word like crazy, insane. I mean, it is unbelievable that there was ever a time that we, believed some of these things. I mean, not kind of hysteria, but to kind of, reinforce what you're saying about this. Like, again, when I looked at like eugenics in North Dakota, like, from what I found, it looked like there was 1,049 victims of sterilization in the state of North Dakota. Of that 1,049 people, 62% of those people were women. So like 620, 30 women
Hmm.
were essentially sterilized. And, it's crazy because it's like, there just the discrepancy. I mean, such, high rate of number. I mean, it's, you know, it just kind of made me think about like with hysteria, like, there's just has to be something wrong with you. It almost seems like, it's like more specific, almost, like genders like singled out more so.
Well, and it's terrifying because, I mean, they were so serious about it at that time. Um, and it was just this whole, if your wife is crazy, send her to the insane asylum and we'll fix her. I mean, I think about even if that was something still going on today, I mean, once a month when we're PMSing, that we're hysteric and you're just going to send us away because of that.
Hmm.
It's like, who were really the crazy people?
Hmm. I mean, you were basically, once you were put into one of our state asylums, there was a good chance that this could happen if you happened to fit that bill. And the other part of this, is a lot of this was specific to the school in Grafton. I mean, it said 60% of the sterilizations that occurred happened in Grafton.
Well, and like, and that is just beyond wrong, but it's not even specific. I mean, you say um, the sexually perverted or even criminals, if that was something that was still in place today, as far as just the criminal part of it goes, you could get a DUI and you're not allowed to have kids anymore because you're a criminal. Or like this, the sexual perverts and going back into just, some of the beliefs. I mean, you have sex outside of marriage and
Hmm.
sterilized.
Yeah. Or if you're, you know, gay, homosexual, whatever. I mean, that was sexual deviance. I mean, like, that was another one. I mean, that wasn't in our country, but still fits. I mean, that came, like, guys, I don't know if you're familiar with this guy, but his name is Alan Turing. Like, he's basically the father of, like, modern computers or whatever. I mean, he basically, I mean, like, broke the Enigma. He created a computer essentially in the 1940s during the war or whatever that allowed them to um, break the encryption on the Enigma machine or whatever. But I mean, the guy is like a national world hero. I mean, just in just incredible intellect, and they sterilized him because he was homosexual. He ended up committing suicide. I think it was in his fairly early 40s. I mean, there's so much wrong with that, but I mean, it's crazy. I mean, you have this person that has, did all of these, incredible things to benefit humanity. And I mean, you think about what more he could have done with his life if he would have been allowed just to be himself. I mean, but yeah, it's like I said, you find these examples and it's just appalling.
No, it's just this idea that, and there is a term for this, and I can't quite think of it. Maybe it is just the eugenics, but just this idea that we can breed the perfect person.
Yeah, I think that kind of, I don't know if that falls under, but yeah, I would say it's probably a part of that. I mean, that's kind of the stuff that, Hitler was attempting to do in Nazi
Hmm.
Germany through, the 30s and, throughout, World War II or whatever. I mean, creating the perfect population of people. I mean, it was crazy. I mean, even, kids. I mean, like he separated kids into, essentially these camps that were more or less designed for breeding.
Hmm.
I mean, it's a horrible term to use, but I mean, it's essentially what I
It's
mean,
what they were doing.
that's what they were doing.
Um,
Blonde, blue-eyed, and
the perfect person.
mm,
One, yeah, I think we can really get into San Haven and the Grafton School and just where that started because the thing that stood out was the segregation part of it, and I think that you see that being addressed now in hospital settings, in institutions, prisons. They had people of all severity levels housed under one roof, um, really without a care. And the documents that I went through on San Haven and Grafton in the beginning, or maybe it was more so in between, there was a period where staff were doing their job the best that they could given the circumstances, but they truly cared for their patients and they were trying to provide adequate support and skills. But then they were overrun. And I believe it was in that article, they had the numbers for the max capacity for these rooms. And alongside that was the number of people they actually housed. And I remember one of those was max capacity was 60, and they had over 100. And I think it was even more than that. But at that point, they were short staffed. They weren't able to provide proper care, which brought up the lawsuit or just the court case that came from that.
That court case was interesting because, yeah, I wish I would have had time to write a little bit more down about that before we came in here. But yeah, it was, I think like 1982, like April or May of 1982 is when this lawsuit was filed, and it was, what was it, like it was a nonprofit. It was like the North Dakota Association for the Mentally Retarded. I mean, like nowadays it's like you'd be like, it sounds horrible, but anyways, it was founded, like that association was actually founded like in the 50s. I think it was initially like six people that were essentially mentally handicapped, or I suppose if you used the language from that time, mentally retarded, that essentially put together this nonprofit to try and improve the conditions, for themselves and for other people in those institutions. But yeah, specifically to that court case though, it was interesting because I think some of the, like what they had testified about was, yeah, they felt like the staff that were working there generally were like doing the best that they could with kind of the resources that they had, but yeah, just horribly overly populated. They weren't being, really, fed adequately. I mean, just,
Well, and just severe neglect. I mean,
mm,
they were very detailed in their observation during this case, and they were talking about how the appearance was so clinical. They had just these white tiles that
mm,
increased the noise level, and you had higher functioning individuals with the lower functioning people who were nonverbal, non-ambulatory, and they would just have, I mean, large numbers in one room, and they would just leave them there with the TV, one TV blaring and all this noise for extended periods of time. And one of the most infuriating parts of that was they were talking about just our human right to privacy, where they had patients who were fully naked in front of others, and that they just weren't even allowed to choose what they were going to wear or what they were going to do that day. I believe it was they said Grafton was a nicer facility than San Haven because they had more um, access to like recreational activities and being able to go outside, whereas San Haven didn't. And it was, that they weren't being fed properly, so there wasn't modified utensils for people who couldn't eat with normal utensils. There was the way that they were even feeding them. They didn't really paint a clear picture, but from how they described it, it sounded as if the patients would be lying down and you'd have a staff feeding them from above their head. And just not having, it wasn't about rehabilitating or care, it was just about housing and keeping them outside of or out of the sight of the public.
mm, yeah. And I think you see that even, just, it's, I will say different, but you still see that as being a little bit of an issue, even in our present time or whatever, where you still see a lot of like, mental health and addiction. I mean, if I suppose you could just say, I mean, there is an aspect of like warehousing people.
Mhm.
I mean, whether you see that, like, just what happens through, people ending up with legal records and ending up in jail to, ending up in different treatment centers or whatever. I mean, it does feel at times that there's more an aspect of like, let's just kind of warehouse these people, and it's not even always about, rehabilitation in a sense, more as it's just like, well, what is a way that we can, get these people into like a, you know, yeah, a place where then we don't kind of in a sense have to deal with them.
And again, even doing what they wanted, because that was a part of this case as well, was again, not having proper documentation, not having enough staff hours, and they weren't even documenting what medications they were giving, and they were finding that people were getting the wrong medication or not getting the medication they needed. And who knows really what they were doing? You talk about sterilization in the populations. I mean, I didn't find anything on it, but I didn't find anything that supported that they weren't trying to do that.
Well, you get into talking about like being like, like segregated or being like, like restrained and all these other things. I wish I would have wrote down that person's name, but this the state hospital, I believe, was sued by, maybe was it the federal government, because of the conditions of the state hospital through, I think, through the 40s and the 50s. I mean, where they talked about like, like just handcuffing people to beds for days on end. I mean, people walking around naked, not having clothes. I mean, not having any documentation or adequate supervision. I mean, like people will just kind of wander off. And oh, I should have wrote that quote down. But the person that like, I think he was the next director that came in after that. I mean, which is pretty significant. I mean, like he like publicly made a statement that just basically said like the days of like, restraining people, treating people inhumanely, treating people like animals is essentially over. But it's like, to see that, somebody, that things were that bad that he came out like as a public statement, and saying that at that time as well is, I mean, it just makes you think about it. It's like, how horrible was that? I think that's the thing, as, we've kind of got into this. I think, especially like for me, like within our own state here in North Dakota is, I mean, I had an awareness that there's a pretty terrible history of treating, mental health and substance use. I mean, really anybody, I suppose, that you label as like abnormal, if we wanted to use that word. But I don't think I was like, had an idea that it was like this bad, especially like I said, within our own state. I knew some of the history at the state hospital and how, at various times that there were some pretty terrible things that happened there. But this whole thing with like the eugenics and the sterilization and just, I don't know if I was really prepared for that. And like I said, seeing that it was continuing, like I said, up into the early 80s is just, yeah, I don't know if I was really completely prepared for that.
Well, and even beyond that, when I was looking at just the different insane asylums that have existed, I think the last one was shut down in 1997. And even then, that's really not that long ago.
No. I mean, we still have a state hospital. I mean,
well, and that was what I said earlier too. Is we had these insane asylums, and some of them are still, at least the building or the site is operating. We just called them hospitals.
Mm-hmm. And I mean, to be, we're not saying that it's the same as it was. I mean, that's I mean, care's improved a lot. I mean, it's different, but
as a result of these inhumane practices, and now there's trainings, there's expectation. You have A&E for monitoring abuse and neglect. There's certain restraints that you can and can't do with people. It has to be necessary, and it's not anymore because, well, they're just not behaving, so I'm going to use whatever force necessary.
Better licensure standards. I mean, I think that's a huge thing. I mean, there's more accountability, there's more oversight. I mean,
and that's the biggest part is just having the oversight, having an external person coming in to make sure that things are being done appropriately, ethically and humanely.
Mm. Well, yeah, I mean, that's like for us, it's like, what is it, every 2 years we have the state that comes in and essentially, I mean, goes through our entire practice and, make sure that we're, following state licensure standards, follow our own policy and procedures, that, all of those things are in place. And it's like, yeah, it can be a little bit miserable. And I mean, there's aspects of that are definitely not enjoyable, but at the same point, as much as I maybe wish on one hand that we wouldn't have to go through that every 2 years, I also understand that there's a need for it, because without it, I mean, the reality is if there's no accountability and people are ultimately left to, I mean, things get missed. I mean, I'd like to think that we're, in a better place than that, but, nonetheless, I mean, accountability is so huge. And like I said, learning, and I think that's another thing to really take away from this too, is it's like, something that, not just pertaining to this, but also just something that's important in life too, is it's like actually learning from history. You see a lot of, well, I mean, you even see that like even happen within our state or nationally. It's like we're, like we want to ignore aspects of our history, or it's like we want to, ban certain books, or we want to keep certain things maybe out of the school or whatever for various, whatever stupid reasons. But it's like, how are we ever going to be able to learn and to grow and to become better versions of ourselves and become a better society if we're ignoring the lessons from the past, the uncomfortable parts of our past? I get some of that's not easy to look at, but like with this, it's not easy to look at, how horrible people were being treated. But like I said, I think that gives us an opportunity to really look at how to be better.
Well, I don't even think so much opportunity, but I feel it's our duty as individuals to learn from history. That's why it's there. That's what our job is to take what we can and be able to build on that. I mean, even no matter how horrible and disgusting these practices were, it led to something else, and it led to what we know today. We do ourselves a disservice when we let others push an agenda and try to do away with history. It's the same thing as these insane asylums. It's shutting the door and not letting that, I guess, dark side of things out, but it still exists.
But no, I think kind of back to where we were at though. I mean, I was just kind of talking about, I mean, like I said, maybe I'm wishfully or trying to like make sense out of this or to spin this in a positive way. I mean, just with the idea that, like I said, I guess medical practices, medical research, counseling, I guess we have to start somewhere. And as horrible as this history is, if we can learn the lessons from it, I mean, and we can continue to try and improve and get better, I think that's what we need.
And not trying to say that those methods were necessary, but what it led to was understanding there's a right and a wrong way to do it. There's a humane and ethical way to go about studying human behavior in the mind, where we're not doing harm to others, where people are able to consent and be a part of the process instead of just saying okay and having to experience something that they don't understand.
Well, I think one thing that is really important, I mean, which has changed hopefully over time, is realizing just because somebody has a mental illness or somebody has an addiction or whatever, they're still human beings. I mean, that's, you kind of look at this history, it's like they almost treated them like they were something other than human. I mean, it was like eliminating them out of the gene pool because they were like somehow like, were less than or didn't have anything worthwhile to contribute to this world, or were unwanted, instead of looking at the fact that maybe they have a treatable condition, that there's something that we can maybe do to help them so that they can still live full, meaningful, productive lives, but they're still human beings. They're no different than you or I or anybody else. And that's the part that's kind of, I think, was a little bit tough to take with that too, is just this idea of like how we view certain populations of people in a different way. I mean, but I guess that's been an issue within our country for as long as we've been a country. I mean, that's a whole other subject we won't get into, but I mean, things like racism, I mean, even, differences, historically, like between women and men, and I mean, just, there's a lot of really not great things about that, but
Well,
point being.
that's what another thing they found on this case with Grafton and Sandhaven was, even outside of mental health and addiction, the population who have intellectual disabilities, the idea that they're treatable, and that's where they started implementing and developing life skills. They found that when you give the proper time and attention and you help people function in a community, they live much better lives, and beyond that they're capable.
Mm-hmm.
Instead of what they were doing, thinking that these aren't people that can be a part of society.
Mm-hmm.
And so with them being able to win this case, they advocated for themselves, and they just needed the proper care in order to function.
Mm-hmm. Yeah. Well, it's maybe a good place to kind of wrap this up for the day in this kind of discussion, but yeah, it was really interesting to dive into some of this history. And I don't know, I guess if I take something away from this, for myself, or something, just kind of that idea that it's like, to keep trying to be better, personally, professionally, and I guess in every aspect of life, is to try and be a better person. Make sure too that we're doing the right things here, that we're maybe not falling into, some of these traps, where we get, burnt out, or we start seeing the people that we're working with as just, numbers on a caseload or whatever, that, we're dealing with real people, and, they deserve to be treated with, respect and dignity, and be given every opportunity that we can essentially give them to try and improve their lives and to get better.
Mm-hmm.
So, well, anything else, Bridget, that you would like to say before we wrap this thing up for the day?
Not without going probably another couple hours.
Yeah, this was one where, I mean, there's so much that, I mean, we could, just, kind of specific areas. I mean, we probably could have made videos on kind of each of these things, from our own state to, just, some of the actual, like, medical or psychiatric practices that occurred, even, like you said, just even more the historical context with, I can't remember what the term you used, but like when you're talking about, like, like letting the demons out and like the boring into the brain, and I mean just some of the, some of the other stuff that's happened throughout history. So there's a lot here, but
Mm-hmm.
it's an interesting discussion. So, all right then, I guess we will sign off, and until next time. All right. Thank you for your time.